Body Solutions, where total physical fitness is directed by a physical therapist. Today I'm going to talk about the optimum ways to rehab or to do physical therapy after a sports-related injury, whether it be a sprained ankle, a sprained knee, or a torn meniscus or ACL, or rotator cuff injury. It's very important that when you get physical therapy for these injuries, that the treatment approach should encompass more than just that body part. Because in sports, you're using your whole body. If you just rehab, let's say if you have a shoulder injury and you just do shoulder exercises, it would be a big mistake. Because having done that injury plenty of times myself in the shoulders and knees from playing sports, as a physical therapist, we realize that when you have an injury and you compensate and do things, not only does that body part need work, but really the rest of your body needs work as well. For example, if you have a rotator cuff or a shoulder pain, when you throw anything with the upper body or do anything with the upper body, the force translates from this shoulder. It actually crosses in my midsection and goes down into the opposite hip and leg. So really, when you're rehabbing a sports injury on one side, you want to work that side, the core, as well as the opposite lower extremity or vice versa upper extremity, because the forces go through your body in that pattern. If you start to analyze any sport, tennis, football, soccer, even martial arts, a punch, or swinging a tennis racket, again, that force is translated through to the opposite leg. So proper approach to physical therapy should encompass not only strengthening and stretching of that area, also the core in terms of core stability, but also the opposite hip, knee, and ankle. And that way, when you rehab with that approach, you will minimize your chances of a re-injury, you will recover much faster, and you will be left with motor patterns or how your brain contracts the muscles in a pattern that is not compensated, meaning you're not going to be left with moving slightly different because of that injury. Because if you move slightly different, or if you're left with any kind of imbalances left to right, studies have shown that if you have one side, left to right or front to back, that's weaker or tighter than the other side by more than 12%, and you really don't notice 12%. We would have to sort of clinically detect that. If it's more than 12%, your chances of injury during sports is 300% higher. So that's 3 times more likely to get injured simply from these minor imbalances. So again, when you're doing physical therapy, especially in our clinic here, we really focus on keeping the body balanced, working on the entire body, even though you may have an injury just in the elbow. Really, the treatment encompasses the entire body. And that's a missing key that we see a lot of physical therapy places, or a lot of people who try to rehab themselves, they tend to miss. They tend to do isolated exercises just for that area, and they also tend to do exercises that are more derived from bodybuilding or look good exercises, straight, plain type exercises. And what we really want to do are these diagonal movement type patterns, because that's how our body moves. Our bodies, our limbs move in these diagonal patterns. We really don't move in these straight patterns. So if you're doing rehab exercises with purely straight pattern motions like this, right, you're making a mistake, because your body is being taught to move in an improper pattern or an unusual pattern. So if you want to combine good physical therapy in terms of a complete approach, moving in the right patterns and making sure your body is left to right, front to back, correctly balanced, that's how you're going to have the most complete rehabilitation. And not only get better from the injury, but also prevent injuries down the road. If you have any questions, just leave us a message on our website or through YouTube or wherever you're watching.